Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Mellie Boagni, and she is the CEO and president of the Arkansas Rural Health Partnership. Mellie, thanks for being here today.
Sure, happy to be here.
So can you start by telling us a little bit about the Arkansas Rural Health Partnership and its mission?
Sure. So the Arkansas Rural Health Partnership was founded in 2008 with 5 hospitals. Really, the idea was, I'm a grant writer by trade, and so the idea was to pull together hospital CEOs to really look at addressing health disparities in the region, but also helping them address their what they want to do with their communities. And we knew that we couldn't do that, get the funding that we needed on a small scale. So we thought that if we could build a bigger geographical area, we would. So we started with 5 hospitals in Chico, Deshay, and Arkansas County. We are now 19 hospitals strong and still growing. 4 FQHC systems, and then all the medical schools in the state sit on the partnership as well. So we started in the Delta area, mainly in Southeast Arkansas area, but have since then covered most of the Delta, and then moving into more of the west part of the state, and then as far up north as Batesville.
What role does the partnership play in addressing healthcare workforce issues in rural Arkansas?
Sure. So the partnership really started, looking at hospital sustainability, looking at addressing social determinants of health. But, we went through COVID together and really began to recognize the issues associated with workforce. We had always had issues with bringing in workforce and doctors into rural, but it became much more of an issue as COVID came about and then passed us, realizing we needed to do something. So what we tried to do is start really looking at, why couldn't rural, recruit? And it really had to do with the fact that we were not doing enough to really encourage local residents to go into healthcare careers. They really didn't understand what was all involved in healthcare. They kind of looked at the nurse and the doctor and never realized, there's so many layers to healthcare, from the business office all the way into dietary. And so really started to put a focus on those careers. So we knew we needed to, one, create education as to what careers were available in workforce. We also need to figure out how we were going to get that information out in a way that they could understand and we could capture their kind of, attention. The other one was how we're going to help them pay for it. And the second thing was how are we going to get them to the fields of study. And so we kind of started with the idea of, okay, we're going to try to educate people about what's in the healthcare field. So we built, and you can get on our website, it's very readily available, but it's a worksite website. And we went around rural Arkansas and interviewed everyone in every healthcare career in a hospital or clinic. And these are rural folks. Many of them started at a lower career and built their way up. They told the story about how they came to be in their career, what the career did, and then the website guides whoever is on the website guides them to the length of that field of study, how much that career actually makes, so what is the salary range, and then the schools that have those programs. So then we started a mobile unit, and we brought this website on whiteboards to schools. And so that's what we do, is we go to schools, fairs, and make it available to the students so that they can play with it. It's just really like a big fun board that they can do. And so as we started doing that, we were like working with colleges, with college councils on board, trying to get them really engaged. But they needed a way to pay for it, right? So then we started writing grants for scholarships. So we've gotten scholarships for health information technology, behavioral health technology, patient care tech, medical assistance. We have 120 scholarships in EMT paramedic. And so we started, working with the colleges and universities and training institutes to try to place students into those programs. Then what happened there was we had the money to pay for the school, but there were programs that were not available. And the catch is we have 120 EMT paramedic scholarships, but maybe 2 or 3 schools in the South rural Arkansas that have programs, and really we were down to 2 accredited programs, and so students couldn't get to those programs. So then we started thinking about, well, what are we going to do next if there's no program? So we just opened up in this past fall and started classes in January in our own academy. So we opened up our own academy that we teach patient care tech medical assistants, and we're able to deliver that education to students where they are. So we can do that virtually and then go to them to do checkoff clinicals, and we organize and do those clinicals. So it really has been a process, but it seems to be working. We hope that we can continue to do more. Part of what I'm doing now is we just got a federal grant to expand this across the state and look at how can we build regional collaboratives to do this exact same thing. And how do we work with schools more? We have found, it was 3 years ago, we had a chancellor from one of our colleges who wanted to expand their nursing program from a 2-year program to a 4-year program, but he couldn't do so because there were not enough clinical sites for him to train students. And so we ended up starting a task force with 9 nursing schools, which the deans of those schools sat on, along with our CNOs, to really coordinate clinical training. So workforce is is complicated because it's not just one sector that can really work on this, and it affects everything. You need your educators, you need whoever is in that workspace, whether it be hospitals like we're doing healthcare, or whether it be any of the trades. You need those employers. And then on the economic development side, is working with the cities and towns to make sure that, we're knowing where to put these folks. Because we don't need 15 EMT paramedics in one county, right? We need them in different counties. So trying to figure out how to deliver that efficiently and to where people have jobs.
So how does this shortage of healthcare professionals in rural areas impact patient care and access to services? I mean, it's a major game changer, isn't it?
Oh, it is. It's, if you don't have the workforce, you can't have the services, right? And so, we're learning that, we are able to sort of like shift healthcare to where a nurse, really an RN or BSN nurse, can maybe operate at the hospital bed level, and we maybe don't need them at the clinical level. And so then how do we build those lower steps of nurses, patient care techs, et cetera, to do those jobs? But it is a barrier. I do think that building a workforce. And you're dealing in rural Arkansas specifically, especially in the Delta where we work a lot with first-generation college students. And so, trying to even get them into thinking in terms of a 2-year degree or 4-year degree is hard to do. So I think the more we can do, and the state is doing phenomenal things now with the new access program and moving into the healthcare sector to where a student can now get an EMT, certification in high school, right? And then they're like, oh gosh, we really like this. And that's the start of them trying to matriculate into the degree programs to where hopefully we can eventually have some of these, mental health, behavioral health folks in rural But the way to do it is through workforce. That is the key. I mean, we're never going to have the access we need until we have the folks that can deliver the services.
And you touched on this a little bit. Are there specific roles or specialties that are particularly hard to fill in these rural communities?
Oh yeah, doctors. OB, as you know, is definitely probably on the top of the list, and I think right next to that, and just as important, is mental and behavioral health services, which can be delivered somewhat through telehealth. You still need some sort of resources available, especially some inpatient in those areas. But any of the, I would say the ologies is what I call them, but any of the specialists, I mean, is really where we're lacking. And how can we utilize telehealth, but also, if you know me, I say it in every conversation, but it's all about collaboration and working together. I mean, we can no longer look at healthcare as a hospital working with a couple of clinics. We're going to have to work with our partnering hospitals to deliver healthcare. And so how can you do that better is by working together. FQHC systems that have ways to recruit doctors that hospitals don't. How do you use those? How do you work with those FQHCs? To provide services. We've got a hospital right now working with the FQHC on OB, and I think it's just such a great model of how we can really, do things better. So, but yes, I would say lots of gaps. The good part is that we're figuring out how to address getting maybe matriculating local folks in. Recruiting into rural is just so difficult because people are not moving into these small towns where the education is not great, childcare is almost non-existent. Transportation's hard, access to good food and activities is not there, and so we've got to really kind of think differently. And how do we, work together with our systems and with our partners to deliver?
So, how does the local community play a role in supporting healthcare professionals in rural areas?
Well, I think that in a lot of ways. I mean, one is that they need to utilize services that are there and not necessarily always go and think, bigger hospitals are better. I really believe that, our smaller, our rural doctors are just as good as our doctors anywhere else. So I think marketing is a problem and communication in rural is a problem. People don't know. I do community health needs assessments for most of my hospitals every 3 years because IRS tells them they have to. And every time we do one of those, we hear, the hospitals, we talk about what the hospital services are, and half the people in there do not know that the hospital does what it does or has those services available. So a lot of it is communication. And those we've tried to start learning how to use, which is comical really, but like local Facebooks, county Facebooks, everyone now, I mean, even, 90-year-olds, my mom, are using, Facebook just to get the latest gossip or what's on the menu at the local restaurant. So, how do we use that more to promote services? So it's a lot about communication. And another thing is rural residency programs. I mean, when it comes to doctors, is really trying to work. And I think everyone says that's the healthcare organization's responsibility and UMS's responsibility, but we just opened up, or we got a grant to start with UMS, a rural residency training program in CrossFit. We do, RHAA, which is the state association, and I sit as the executive director of that. We do medical school trips where we take them out in rural, and the community feeds them and shows them around and talks about, how great it is to live in rural. We need to be doing more of that. I mean, but the community's responsibility too is to help do that, and how do they support those initiatives? To get people, there. We have a lot of requests for nurses to move in, respiratory therapists to do things, opening up their homes or at least helping them find a place to live. I think is so big. So I think, really the community getting more involved in their hospital foundations and helping them with those efforts, I think is huge.
And telehealth has become a key solution in many rural areas. How has the expansion of telehealth impacted workforce needs and patient access?
So I think we talked earlier, but definitely, telehealth expansion. We saw that to be such a jump during COVID, and people starting to accept that. And I think as we go into the younger generations, they feel almost more comfortable talking to a phone or a iPad or something than they do in person. So I think we're starting to see a lot of opening up. I think definitely specialized help. We're hearing stories about how great it is. Someone had open heart surgery at a hospital. They can even do cardiac rehab via telehealth. Things like that. But mental and behavioral health, I think, is something that we really need to be focused on and really pushing. And then working with those hospitals. No one, the thing about telehealth is no one really wants to give up doing it, right? Because that's where the money is in the reimbursement. And so, how do we work with our partners? And I think as you start to see systems working with hospitals, et cetera, you're going to start to see more telehealth that is, easily accessible. And then I think it can also be used in the workplace. Some great examples. There's some great examples out there of, workplaces, companies that are, encouraging their employees to use mental and behavioral health telehealth services and actually paying for those services for their staff. So I think it's definitely a solution. I think seeing more of that in emergent care is going to be also an issue as we start to see closures in hospitals. Or downsizing, having telehealth available on the transport piece is going to be another place that I think we're going to see a lot of significant movement there. I was totally, just the other day, we worked closely with a big AI company that wants to do some work in rural Arkansas. And, AI is just changing the world daily or minute by minute. So you never know what's going to be next. They were saying that, this company that's delivering prescription assistance via drones to homes, and how is that working, and robots that are going into homes and, testing and, and so I do food delivery. I was like, well, can you carry food? They're like, sure, we could do that too. So, I think we're going to really start to see technology and telehealth really move fast.
And in close, looking ahead, what are your hopes for the future of the rural healthcare workforce in Arkansas?
I hope we're more localized. I think on my end, if I could walk away from my job and say if I did anything, it would be to see more folks in rural doing the jobs in healthcare, to where we're not having to contract out staff, and people are staying in rural because there's jobs there. So I think for me, healthcare workforce, I think being owned by local, and I say owned, it doesn't mean that the hospital can't affiliate with an organization, but I think having folks from that area that are working that hospital, that are the people see at church and the people that know their families, I think it makes all the difference in the world. And it also gives them a comfort. Anyone wants to know their doctor, right? Or know their healthcare provider, some sort of way. And so, how do we build that? How do people start to have babies, locally and not having to drive 3 hours down the road? So, I'm hoping that the workforce, is more diversified. I think we need that, and I hope healthcare stays local as much as possible.
And for more information for those that want to find out more about this partnership, should they go to your website? And where's the best place to start?
Our website is the best place to start. We have everything we do on our website, and you can pretty much pull any of our initiatives that we have there. Contact is pretty easy with everybody. We do a lot, but we're a small organization. And anyway, we're growing fast, so we're probably in someone's area, whoever's listening out there. So. And we're always looking for new partners and collaboration any way we can help.
Well, Mellie, thank you so much for talking about this important initiative and all that you do for the state of Arkansas.
Thank you.
And that's it for AFMC TV. Have a great day, and thanks for watching.